So these sebaceous cysts are developed usually a kind of the retention cyst. Means the cysts are developed due to the blockage in the duct or in the blockage in the mouth of the sebaceous gland present in our skins. You know, our skin has the sebaceous gland, so that sebaceous gland secrete the sebum. So that sebum is basically for the moisturizing of our skin and keep our skin moist and shiny. But if anyhow the duct of that it opens over the skin. So if the duct of the sebaceous gland or the mouth of sebaceous gland, usually the duct opens along with the hair follicles. So if anyhow that duct is blocked, or the mouth of sebaceous duct is blocked, so that the but the sebum is continuously secreting inside the gland, so that collected in that the gland, and that form a cyst that is called the sebaceous cyst, because the material present inside the cyst, that is a semi-solid, a very foul-smelling material called the sebum. Along with this sebum, there must be some dead bacteria and the dead cells, discriminated cells present in that cyst, that secretions. So always most of the dermoid cyst present in our the sites, that is the scalp, face, scrotum, and the back. But because there is no sebaceous gland present in our palm and sole, so the sebaceous glands are never found on the palm and sole because there is no sebaceous gland. These are a kind of the retention system we already discussed, because there is a due to the blockage of that duct, there is a retaining of that sebum inside, so that is a kind of the retention cyst also. The peculiar feature of the sebaceous gland present over the skin is the punctum. You can see in the picture, in the first picture, this is the black spot. So that black spot, it indicates the blockage of the ducts. So that is called the punctum. It is the characteristic feature of the sebaceous gland present over the skin, present in our body, except the cyst present over the scalp and scrotum. Because the cyst present over scalp and scrotums are never have a punctum. This is the just exception. Keep remember it. The clinical feature of the cyst includes these will be the spherical in size, and these are present in the skin. These sebaceous gland cysts are present in the skin, so you cannot separate the skin from this gland. So the these means this cyst, this type of cyst always fixed with the skin and mobile with the skin. These cysts can be mobile with the underlying structure, but you cannot separate it from the skin. In the contrary, you can separate the skin from the lump, just like dermoid cyst and the lipoma. Second thing, always spherical in shape and smooth, and until unless the calcification is happening, it become soft. Indentation may be present. Indentation means when you press your finger over this lump, the pit is formed, and that will refill again slowly because of the presence of this pultaceous materials inside the cyst. That's why the indentation is present. Usually these cysts are non-tender. Trans-illumination test will be the negative. If it is in a larger size, then maybe the fluctuation test may be present, or sometime fluid fill may be present. The cyst, this CBSS cyst are usually painless and usually attain size up to 2 centimeter, not more than 2 centimeters. Very rarely we go into the 5 up to 5 centimeter, otherwise maximum size up to 2 centimeters. Never attain a very big size, just like lipoma. These cysts remain this limited site as well as limited size. If any sebaceous cyst is painful, that clearly indicates the inflammation, and that may be due to the infection in that second by any secondary, any kind of the bacteria may call the infection. So usually the sebaceous cysts are painless, but if it is painful, it means it having any kind of the bacterial infection. Now the process of the removal of the cyst, uh, the management uh, the management include the excision of the cyst. You have to excise complete cyst. If you leave some part of the cyst, then that may cause the recurrence. So complete excision of the cyst is the treatment of choice. If the cyst is inflamed, then first give some medical management to inflammation get subside, then you excise the cyst. Because if you excise the cyst in the stage of the inflammation, that tissue is very fragile and you cannot differentiate the healthy tissue as the and the unhealthy tissue, so that the you may leave the some part of cyst inside and complete excision may not possible. So first once inflammation subside and one granulation layer is formed around the cyst, then you can easily separate the cyst from the healthy tissue. So for the excision, there is two method: one elliptical incision and one incision and drainage. So elliptical incision is used basically for the the cysts which are non asymptomatic, means which are asymptomatic, means which are not which have no sign of the inflammation. So in this the method of the excision of this, you can see in the picture. First you have to do the anesthesia. The usually local anesthesia is sufficient. You have to block from uh, through from all around. You just give the local anesthesia. Once the effect is local anesthesia effect is there, then give an electrical incision around the punctum. This is the punctum. You must give a elliptical incision and you must hold this skin with the artery forceps. Do not hold the cyst, hold the skin. That's why we give the elliptical incision, because if you hold the cyst with any instrument, it will rupture and you may not able to remove the complete cyst, which is important. So that's why we just give the elliptical incision, and with this incision you hold the skin so it will not rupture the cyst, and then you can separate the cyst from the nearby tissue clearly, and then you just close the wound. Understand? So removal of complete cyst wall is essential to avoid the recurrence. Before closing the wound, with interrupted mattress sutures, hemostasis must be achieved. Hemostasis means if after removing the cyst, if the wound has any kind of the bleeding, you must have to stop that bleeding either by securing with the suture, either by the cautery forceps, either just by the pressure method. You have to stop the any kind of the bleeding. Then you have to give the mattress sutures. Mattress sutures are the kind of sutures which take which will which when we apply it takes the deep tissue, so just to obliterate any kind of the dead space and give some antiseptic dressings. If the cyst is infected and patient comes to you, then you have to do immediately incision and drainage, because once pus is formed, then it is not possible to give the conservative management and patient may not get relief for that. It will rupture itself. So better you do incision and drainage. Just treat like the abscess. After giving the local anesthesia, just give the incision over the cyst and squeeze from both side, so that all the CVSs, the all the sebum material comes out, and then you just hold the layer of the cyst wall. Means you just hold the cyst wall with the forceps, and then you separate the cyst from the nearby unhealthy and healthy granulation tissue, and that you must remove complete the cyst wall. Try to remove complete cyst wall, and you just leave the wound like that. Means you have to do the healing with the secondary intentions, and do not close the wound with the suture materials. Understand? So these are the two methods to these are two surgical methods for the sebaceous cyst. First, for the non-inflammatory, non-symptomatic, by the elliptical incision, and if it is painful, symptomatic, and pus is there, infected, then incision and drainage, just like the abscess. You can see in the pictures, because this is the very small cyst. This is the black spot that indicates the punctum. So here we do just elliptical incision and excise the complete cyst and give the mattress sutures. Next, the dermoid cyst. Dermoid cysts are nothing, just when the some epidermal cells are de-squamated inside. Some epithelial cells de-squamated deep into the skin. Means the skin within the skin. Understand? So the cyst lie in the deep to the skin and lined by the skins. May call the epidermal cyst. These cysts also contain pultaceous or toothpaste-like materials, which contain de-squamated epithelial cells. These cysts are lined by the squamous epithelial cells, and these cysts never possess any kind of the punctum or the black spot, on the contrary to the sebaceous cyst. There are four types of the sebaceous cyst: sequestration dermoid cyst, implantation dermoid cyst, tubular dermoid, and teratomatous dermoid. So one by one we discuss the sequestration dermoids. So these are the congenital type of the cyst. When during the embryonic development, the epidermal cyst cells are buried into the line of the fusion of when the we know our body form in the two form, and then it get fused. So at the time of the fusion, embryonic fusion, if the epidermal cells are buried in between these uh, uh, other cells, that mesodermal cells, then there is development of this sequestration dermoid cyst. That's why these cysts are usually found at the line of the fusion of the two embryonic segments. So in the midline of the body, in the inner canthus of the eye, the post auricular areas, and the head and the neck areas. These cysts are lined by the stratified epithelials with hair follicles, sebaceous gland, and sweat glands. So collection is the pultaceous hair, sebum, and the desquamated cells. The common sites are the midline of the body, neck, outer canthus of eye, post auricular area, skull, and the midline of the face at the root of the nose. The clinical feature is similar to the sebaceous gland. If it is non-infected, then usually these are slow growing and not painless, and usually congenitals. They hardly attain a big size because they grow very slowly. So only the problem of the patient is that cosmetic disfigurement. Otherwise, no complaint is there. On the palpation, you may found non-tender, mobile, free from skin, smooth, regular, cystic swelling. On the contrary, sebaceous cyst was not able to free from skin. Here dermoid cyst can you free from skin, means just below the skin you can separate cyst from the skin. Indentation may be present, punctum is not there. The cysts are neither compressible not reduced, means you cannot compress by pressing, you cannot, the cyst will not disappear and the size will not decrease. Transcell illumination test is negative as the sebaceous cyst. Treatment: surgical excision is the treatment of the choice. If the cyst is present in the skull, on the skull, then go for one X-ray to know the any intracranial relation. Sometimes the cyst may extension have the intracranial extension, or sometimes the cyst may erode the skull wall. So before doing surgery for that, make sure that the bone is intact and the cyst has not damaged the skull bone. And the excision method is same as the sebaceous cyst. You can give the elliptical incisions either in the IND if it is infected. Complications happen: the infection, suppuration, ulcerations, or pressure on the adjacent organs. These are complications may happen. You can see in the picture. Then implantation dermoids. It is an acquired type of the dermoid cyst where a patient having history of the puncture injury on the skin, usually multiple times, usually the tailors which puncture their finger multiple times with the needles, so that these epithelial cells buried inside the skin and grow there, and they form that a dermoid cyst, commonly found in the gardeners, tailors, and the women's. The common site is the palm of hand, finger, especially tip and palm, and the sole. The clinical features: usually patient have the history of the pricking injury. On examination, you found a tense cystic swelling, often hard in consistency. There may be a scar of injury. Elicitation of the fluctuation is difficult due to the very small size, but if it is bigger, then fluctuations may be there. Here, the treatment of choice is also complete excisions. Complications that happen, and the method of the excision is similar. Teratomatous dermoid, this is cystic swelling develops from the totipotent cells with ectodermal predominance. Okay, so these cells are usually contain mesodermal elements. These are usually that totipotent cells, the cells which can transform them to in any kind of the tissue in our body. So that is called the totipotent cells. So these cysts are usually developed from the totipotent cells uh, with ectodermal in prominence. So the cyst, when developed, it contains the material inside the cyst is usually the mesodermal origin, the bone, cartilage, tooth, hairs, and other cheesy materials. The example of the teratomatous cells are cyst is ovarian cyst, testis teratoma, mediastinal cyst, post-anal dermoid, and retroperitoneal cyst. So these are rare kind of the cyst developed due to from the teratomatous cells, and these the treatment is also the complete excision. Then tubular dermoids. So these tubular dermoid, these are kind of the dermoid cysts which are developed due to the blocking of that, means the unblocking means uh, usually that there are few ducts in our body which should be closed at the time of the development, but sometime if that ducts remains open for longer time, and that develops a kind of the cyst that called the tubular dermoid cells. So these are the kind of the congenital cyst. The example of this is thyroglossal cyst and posternal dermoid and epidermal cyst in the brain. So these cysts form due to the accumulation of the secretions of the line of the ectodermal cyst of unobliterated portion of the embryonic duct, because these embryonic duct supposed to be closed after birth, but sometimes if it remains open, so that develops the collect the secretions and develop the cyst. So the example of the tubular dermoid is the thyroglossal cyst, post anal dermoid, epidermal cyst. The treatment is also the same here. Complete excision is the treatment of the choice. So we have in here